My wife has neuroendocrine cancer, and she used to have 2 drainage ports after the surgery because there were some complications. She came home from the hospital a week later. She had to go back into the emergency to have the 2 drains put into her liver. She had a liver resection, and I guess something went wrong, and some drains had to be put in. The one was removed because nothing was coming out of it, and that's healed up nice. The other one is still draining, and there seems to be some changes here. So originally this was coming out more like this color here, just this yellow. But lately we've been getting this, and it was pretty much this and just this. And my wife wasn't in any additional pain. She didn't have a fever or anything. But the nurse said we should get that looked at, so we went to the doctor. She sent us to emergency to get looked at. And they looked at it and said, well, you don't seem to have an infection because your white blood cell count was below 11. 11 is considered the number or threshold that they look at, I guess. But anyways, they weren't sure what this was, so they put her on antibiotics. Since then, it's been, this is I think day 5 or 6. This stuff is clearing up, so now it's a little bit of this and a little bit back towards this, so maybe it was an infection. But at any rate, I'm going to do a flush here to show you just a flush. And you may be looking at this going, well, what happened here? So this is, normally there's a white piece of plastic out here, but it cracked. And we asked the doctor, what can we do about it? And he says, well, just wrap it up best you can. You can't get replacement parts. You can get replacement parts from like where it's connected here down this way, but you can't replace anything in here. If you pull this out, I guess something happens. You can't replace these pieces. So we had to just patch it up. So I used some rubber, actually it's not rubber, it's silicone tape. It's not adhesive tape, it's just you stretch it and it's self-fusing. So what happens is the tape, as you stretch it, it sticks to itself just because it's self-fusing. And so that's made a permanent, you can't peel this tape off, it's permanent. You'd have to cut it off. Anyways, I'll get into doing the flushing. And so this is the bag. You can see there's some bits in there. There's not a lot of liquid in there, but it's yellow, and then there's some darker colored stuff here. I don't know if it's just because there's more of it there. So I'm going to do the flush. So we have a 10 cc flush syringe. These come in a plastic bag so that they're sealed, never been touched by human hands, I imagine. We want to open this up. We want to get the air bubble out of there, so just clear the air bubble from there. And so there, it's been cleared. And then we want to take the cap off here. To take the cap off, I take these alcohol pads, and I open up the package. And normally the nurses will sometimes, not always, use gloves when they're working on anything here. So you take the alcohol pad, and we're going to remove this. Like, I could just remove this, but I've just gotten in the habit of trying not to touch anything over here with my bare hands. Even if you have gloves on, you don't want to touch, you don't know if you've touched your face or anything, because people touch their face so often. You want to try to keep this environment as sterile as possible. So I'm removing the cap with the alcohol pad, putting it on the piece of alcohol pad packaging that I opened, so it's sterile inside there because it was just closed, sealed. And then we're going to just wipe down the end of the tube here. Make sure it's nice and clean. Then we're going to take the syringe, take the cap off again. I've already cleared the air bubble from it. And it just screws onto this. Now there's this valve here, we can switch it. Right now it's off towards this port. We can switch it off towards the patient, and then now it's open from here to here. There's nothing here, so there's nothing going to come out there. So now what I'm going to do is I'm just going to push a little bit, and that's going to clear anything that's in this part of the tube, and it's going to push it this way. I don't want to push that into the patient. I'm sure my wife would appreciate that. And then once I've pushed a little bit of liquid out, you can see it's cleared up there a bit. Then I'm going to rotate this towards her, and I'm going to flush towards her. So what I do is I put my hand with my finger there, just so that I can kind of gauge how much I'm going to be pushing into her. I'm just going to push in a little bit. This is about 2 mils, 1 or 2 mils. It is marked on the thing here, so each thing is 1 mil or 1 cc of flush. So I'm going to push a little bit of that into her, and then I'm going to rotate it back to the off position for the syringe, and I'm going to let that flow back. So I'm going to give it a chance to flow back so that I'm not building up too much pressure, pushing too much into her. And then once nothing is moving, I don't see any movement there, then I'll go back so that it's off towards the bag, and it's going to push it in towards a patient. I'll mark approximately 1 to 2 mil more. And then I'm going to turn it off, and we're going to see if something happens. Yeah, there's a little bit of movement there. There's some stuff coming out there. And I'll let it go for a little bit. It's a process that you don't want to rush. In the past, when the nurses were doing it, they were pushing 10 cc's in her. 10 cc's would cause her discomfort and pain the next day. So it wasn't painful in doing it today, but the next day it was painful. So I'm just doing it in stages. So I'm doing a little bit, and then I'll shut it off to the bag again. Do another couple cc's in. I'm kind of trying to pulse it in there too. I don't know if that's critical, but I saw one of the other nurses doing that, and that kind of makes sense to me. Let that drain a bit. It's maybe not draining so much that you can see here, but if I move the bag over, you can see it down here, it's moving. Now, in the past, I've asked my wife to just cough, because I found when she coughed one time, it forced out some of the stuff. So I'm going to ask her to cough right now. And what that does, I'm not sure why that does it. I think it's just you've tightened up your stomach muscles, like all your muscles, and it creates a little bit of pressure, and it forces out a little bit more stuff, and that's what we want to do, is we want to get that stuff out. Okay, I'll put a little bit more in. Switch it back to off towards the needle, so now it can flow again back towards the bag. So I'm not going to do the full 10 cc's into her. I'm just going to do, I don't know, I did maybe 5 cc's into her. And I'm just going to do the rest of it, I'm just going to do into the bag, just to clear this out so that we can see what's coming out in the next hour or so. So it's off towards the patient, I'm squeezing it, it's going back into the bag. And then when it's fully empty there, switch it off. Remove the syringe. I'm going to get a fresh alcohol pad. I'm just going to clean this again, make sure that there's nothing there. And then I'm going to use this to pick up the cap or cover. Now realistically, you do touch the outside. The outside is exposed to, it's the inside of the cap that you don't really want to touch, but I'm trying to be as little contact with it as possible while it's open. That's it. That's the process I use for cleaning my wife's drainage tube. Follow your doctor's recommendations. This isn't a tutorial. This is just showing you how I do it with my wife and from the things that we've learned.